spring into summer by looking younger. Call Vein Clinics of Hawaii to schedule your free consultation today. Facial and body rejuvenation procedures are designed to help you look and feel your best without breaking your budget. Reduce pigmentation, fine lines, wrinkles, scarring, and stretch marks with minimal invasiveness or side effects. Confused about which procedure is right for you? Call 427-5565 to schedule an appointment or visit veinclinicsofhawaii.com.
Aloha Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Well, aloha and welcome. No matter where you are in Hawaii, you're not too far away from a vein clinic. Vein Clinics of Hawaii, 4 locations, Big Island, Maui, Kauai, and here on Oahu. And started actually on the Big Island and sort of moved statewide since then. And sometimes, we have to say goodbye to big swaths of our audience because we appeal to different things and on this show. Today, we could say goodbye to about 50% of you, but we're going to ask that you stay around, at least for the first few minutes, to see what we're talking about today. And what we're talking about in this program, and I learned a tremendous amount about it already from Dr. Juliff, and so will you. I guarantee it if you stick around, guys. We're going to talk about pregnancy and vein disease today. All right? So we know that half of you won't get pregnant. And we know that half of you are way too old to be pregnant, but you certainly have family, you got kids, you got grandkids, and pregnancy and vein disease are almost linked arm in arm. And we'll tell you why as this program ensues, because there's a lot of things about vein disease that while you're pregnant, you have to just sort of put aside. So you have to have a pretty good leg up, if you will, on exactly what's going on. It's kind of tricky, Doc. And I don't want to say goodbye to our guys. And the reason why is I think we all need a reality, all of us guys, to know exactly what women go through to have our babies.
Yeah, well, that's true.
Yeah.
There's tremendous changes that go on in a woman's body and the symptoms that come along with it, and long-standing kind of repercussions that might result. It's good if the husband kind of does know what's going on and can do his part to maybe hopefully minimize what might happen. Vein disease is one of those things.
Well, I do know one thing. You don't usually associate vein disease with younger people. I mean, we've talked about this a lot, and there are certainly many, many exceptions to that. Little kids with vein issues, but and maybe pregnancy only because I'm thinking that there's something going on in the middle of your body for these women that really interrupt normal things like blood flow and all this kind of stuff.
Right.
So I know you're going to medically explain it, but don't women's bodies go through a real change while they're pregnant and after they've given birth?
Yeah. Oh, yeah.
Big time.
Big time, yeah. Pregnancy is one of the 5 top reasons why people might develop long-term vein disease and varicose veins. There are several specific reasons that occur during pregnancy as to why that happens. But the first is the blood volume of a woman.
Of course.
When she during pregnancy, it increases tremendously. It increases by about 50%.
Wow.
So that's a lot.
Not all going to be used by the fetus right away, though.
No. It's just it's just a general increase in blood volume, and if you're increasing your blood volume by 50%, that's a couple liters, 2.5 liters of blood, which is substantial. So that blood has to go somewhere, and one of the places that it's going to hang out, obviously, is in the veins. The veins tend to kind of stockpile blood. And by that I mean it will, obviously the blood is always moving back toward the heart, but, veins can, for instance, the veins in our legs, they can store a fair volume of blood. And that's why, That's why people often, when they're standing in one place and not moving around much, sometimes they get lightheaded and pass out. That's why, because the veins in our legs can store blood, and as you're standing in one place for a long time, the blood all kind of pools down into your legs, and basically your blood pressure decreases and you pass out.
Well, we have talked, by the way, gang, appropriately for a lot of us that are in second and third jobs, because we either have to because we need the money or because we just like to do stuff. And a lot of that, especially as we get older, involves standing. And like Doc's saying, sometimes the first questions you ask of a patient is, do you stand for a living? Are you standing up all the time? Well, are your legs always sore? And one of the things that you hear from women, it seems a lot, is, oh, my aching back and oh, my legs.
Yeah, right.
So there you go.
Especially during pregnancy, sure. So blood volume goes up, and then the other thing is or a couple of other things, but the second thing is that hormonal changes that occur during pregnancy, and that's primarily attributable to a hormone called progesterone. But progesterone levels go up, and progesterone is a hormone that tends to relax tissue. The skin can stretch a little bit to accommodate this thing that's in there. Yeah, well, sure, that's part of it.
Yeah.
But the reason that vein disease occurs more commonly or is initiated during pregnancy is because that progesterone has a relaxing effect on the veins and other blood vessels, and they tend to dilate. As the veins tend to dilate, then they start to lose their functional capabilities. We've talked before about the one-way valves that are in veins that keep the blood moving in the right direction. Well, as those veins dilate, then the valves become less functional.
I was going to say
lead to problems.
Yeah, could they even be separating a little bit, because the wall of itself might be expanding a little bit, but that doesn't mean the valve's going to expand. So it may not close. Maybe for a couple of months they don't close properly.
Right.
Yeah.
That is exactly it, Mike. You described that perfectly.
That's another step towards my medical degree in vascular surgery. Okay. Yeah.
So that's going on, and then as you alluded to before, as the uterus is becoming larger and larger as the pregnancy is evolving, that uterus starts to settle on or impinge upon the big veins within the pelvis, and veins that are bringing blood back from the legs, and those veins in the pelvis can be quite large, and it makes the blood more difficult to pass up from the legs to the pelvis and back, eventually back to the heart. So those are the three reasons why pregnancy can lead to abnormal vein function, which may or may not persist after the pregnancy, after delivery occurs. Now, there are some secondary reasons also that impact whether any one particular woman is going to develop venous disease, and the first one is genetics. I mean, genetics is such a common reason why people develop vein disease in every situation, and obviously that's going to affect people during pregnancy too. So if you've got that genetic predisposition, it's going to be more likely that you're going to develop it also during pregnancy. Weight gain, those women that gain a little bit too much weight during pregnancy, they're at a little higher risk of developing venous disease because of it. And then also women who tend to be a little more sedentary, or just, pregnancy itself sort of leads to a certain amount of increased, immobility. And, you're naturally going to become a little more sedentary while you're pregnant, especially during those latter stages. And that in and of itself can also lead to some problems with the progression of venous insufficiency and chronic vein disease. So, in arteries, again, comparing arteries to veins, you might say, well, are there problems going on with arteries in a woman during pregnancy? Not the same sort of thing. The arteries, the structure of the arteries is so different than the veins, the arteries are a little thicker walled type blood vessels. There's more of a muscular layer to arteries, so they withstand variations in pressure and kind of external sort of things. Veins, the walls are very thin, very pliable, a lot more flimsy, and so obviously they're going to be affected so much more by all of those changes that occur during pregnancy.
I think that if it were possible, and that's why, guys, I hope you're still around. We didn't want to scare you away. And those of you gals that are listening, I think it would be good if you grab your significant other by the ear and bring them into the room, because I think that it's not just appreciating what you're going through, but understanding it. And I think sometimes, Doc, that maybe, when a woman is getting prenatal care or whatever, they are able to see their OBGYN or whatever, but sometimes they don't. They're looking on the internet. They just need people to say, can you rub my back a little bit, or can you
Sure.
do a little bit here? Can you help me out a little bit?
Yeah. I think it's, the significant people in a woman's life, if they can accommodate what that person is going through, it's a tremendous benefit. Absolutely.
Yeah.
But so what are some of the potential complications that pregnancy may lead to, and with respect to vein disease? And luckily, most of the time, most women have are bothered by the process. Just aesthetically, they may develop more prominent veins in their legs and other places, other limbs and stuff. But I think that probably the majority of women who get pregnant, the venous changes are primarily aesthetic. However, there are more serious kind of complications. Increasing importance. Just the persistence of symptomatic varicose veins even after the pregnancy is over. So, some number of women are going to develop vein disease to the point where, it's going to continue after their pregnancy, and they're going to have to deal with it. Then there's a little higher group of people who are going to have persistent vein disease, and they will have, severe symptoms that will be difficult to control. And obviously, then it'll need to be addressed after their pregnancy.
I do know one thing, that, when you talk about standard maintenance and treatment of varicose veins that are maybe not, threatening with clots or any of that kind of stuff, which we're going to talk about, because even some of this can be very alarming during pregnancy, that there are a lot of times when you just wouldn't recommend treatment until after baby comes.
Oh, yeah, definitely. Yeah, we're going to touch on that in a little bit. But, typically we don't do a lot during pregnancy. But so then the next thing that could happen is superficial venous thrombosis, something that we call SVT. And we've talked about that before. The layman's term for superficial venous thrombosis is just phlebitis. Everybody.
We call that the Richard Nixon affliction, right?
Yeah. So, and that's just a process by which, during the pregnancy, the woman is going to develop a varicose vein. It's a dilated superficial vein. The blood in that vein, for whatever reason, clots off, and you develop thrombus in that little segment of vein, and it can become very inflamed, and it can be painful, And typically, it doesn't lead to much more than that. Although once you develop an SVT, it could propagate to DVT, deep venous thrombosis, but typically it doesn't. And we treat those women just symptomatically, usually with warm compresses and compression stockings and whatever kind of anti-inflammatory or analgesic kind of medication they can use.
I was actually thinking earlier when you were talking, I was listening, paying attention, I'm thinking to myself, it may not be fashionable, but it sounds to me like compression leg wear for women that are pregnant probably has a lot of benefits. I mean, I'm not just talking about keeping swelling down, but helping circulation and making it possible for you to probably get way more done or tolerate it during a normal regular day.
Mm-hmm. Yeah. I think probably one of the most important things that a woman can do to support her vascular health during pregnancy is to wear some sort of support, garment. And find a comfortable one that you can handle on most days, and kind of stick with that.
Yeah.
But that helps tremendously. So the next potential complication is DVT, deep venous thrombosis.
Okay, now I do know that sometimes that you need to make a decision, even if somebody's pregnant, to do certain things. If there is evidence of a deep vein thrombosis, is that one of them that would require treatment, or treatment would be recommended?
Yeah, sure.
Yeah.
So women are 5 times more likely to develop a DVT during pregnancy. And interestingly enough, and this is just something I learned here recently, is that the likelihood of a blood clot or a DVT occurring is equal through all 3 trimesters.
That's very interesting.
It was surprising to me because I always kind of felt like, well, probably the greatest effect that's happening to that woman during her pregnancy is in the 3rd trimester.
Sure.
But actually, it's equal throughout the entire time, and the risk of developing a DVT goes on for 6 weeks after the pregnancy. So, and I think that...
Wow. Poor lady. I mean, here she's gone through 9 months, and she's got another 6 weeks to deal with.
Yeah.
Right?
And part of that has to do with, aside from even the mechanical reasons why a woman who's pregnant might develop a DVT, just the pregnancy itself makes them a little more hypercoagulable.
Sure.
So, their blood is clotting easier than it normally would. So, does that patient need to be treated? In many instances, yes. And we kind of use the same guidelines as to whether to treat or not for everybody. But if they have a blood clot that is of the size and location that would be threatening to them, then we have to put them on a blood thinner. Now, can they take the run-of-the-mill oral blood thinners? No, they should not, because many of them might be dangerous for the pregnancy itself. But typically what we give to women for as an anticoagulant during pregnancy is heparin, or something that we call low molecular weight heparin. It's a specific type of heparin that requires injections.
Yeah, and by the way, that's one that's been around a long time, right?
Right.
Yeah. And many look. I tell you where my real heroes are. It's not as, I guess, as expected in modern generations to have a lot of babies, but still some people do. And, just to show you how dedicated of moms they must be to know that they're going to go through that again, or 2 or 3 or 4 times. It's really quite amazing.
Yeah.
That they, or at least that they want to say, look, don't even talk to me for 3 years about this, please. But some it's every couple of years is when they're going to have a baby.
Yeah. It's you have to admire that, absolutely, that maternal instinct. I know that probably if it were men getting pregnant, there'd be a lot less children.
There wouldn't be many kids.
Yeah.
And you know what? I think that you've heard this before. That guy, he's strong. He can really tolerate pain. And I defy any guy that thinks he can tolerate pain. And, and as a physician, I know you know that sometimes it's the pain of frustration of being so uncomfortable that you can't do anything about it. And in that these ladies will have another baby down the road, I give them a gold star on their chart. That's amazing for me.
Yeah, absolutely. So in addition to DVT, obviously, and we've talked about this in the past, you have to worry about pulmonary embolism. And can that happen? It definitely can happen, just like it can happen any other time. And pulmonary embolism is something that is potentially fatal. And interestingly enough, pulmonary embolism is the most common cause of maternal death in developed nations.
That's amazing. It may be, it would have been thought, in underdeveloped nations it would be easy to explain, but it's not.
Well, I think, in underdeveloped nations, that same thing happens, but there are many other things like infection and disease that often leads to maternal death in those countries. Yeah. But, as being the most common cause of, death of the mother in a country like the United States, it's a very interesting fact. So do they, and obviously, if they've developed a DVT, PE, then, the same sort of parameters apply with respect to treatment. They definitely need to be treated.
Yeah, thank goodness for the modern day, by the way, friends. If this had happened before, 40, 50 years ago, somebody pregnant with that case, to do the invasive procedures that used to be done, it would be very difficult on a pregnancy, wouldn't it?
Yeah, definitely. So then, another thing that women get that are sort of related to varicose veins are hemorrhoids.
Yeah, I was going to ask you months ago. I know that you're going to tie in what we're talking about, but how much do hemorrhoids in regular folks play to either adding to or making vein disease worse because of pressure, or whatever the reason? Yeah,
it's not like they're going to make the vein disease worse otherwise, but do hemorrhoids occur, for some of the same reasons as varicose veins in our legs? Yeah, definitely, especially during pregnancy. It's that additional pressure within the veins of the pelvis, because hemorrhoids are basically just veins in that area, and those veins are emptying into the deeper pelvic veins, and as those pelvic veins become pressurized because the uterus is getting bigger, they dilate, and the progesterone effect, etc. So, luckily most of the time, hemorrhoids are just an annoyance, a symptomatic problem, and that's the way we treat those. Basically we just treat the symptoms, but we encourage also, the dietary changes and those types of things to limit the potential for developing it.
Yeah, we're looking at and this is once again a really sort of bigger picture approach to this. I don't know if you've ever heard these things in the same order that Dr. Juleff is presenting them in. It's just a good time for me to remind you that the program is being brought to you by the Vein Clinics of Hawaii, and Dr. Juleff, the medical director, flits all around all the islands. Big Island, of course, is where the Vein Clinics of Hawaii started, and then it branched to Kauai and Maui, and now here on Oahu for the last couple of years. So he's got a great cadre of folks working around him that specialize in this. And I guess there are certain times of the year in certain parts of the country that there are more pregnancies than others, whether that's related to being indoors in the winter and, being in front of the fireplace or one of these things. We have babies here all year round.
Yeah.
So it must be very interesting that some of your regular patients in the Vein Clinic's offices have to take a little hiatus and to get through a pregnancy.
Sure. Yeah, definitely.
Yeah, it's pretty interesting. With regards to hemorrhoids, when you remove veins normally in normal vein treatment, what if somebody has a hemorrhoid issue, not pregnant, that just has a hemorrhoid issue? These are veins.
Mm-hmm.
And so obviously you don't want them to stay there. There's a lot of people that take, I guess, medicines and things. Why would a medicine work any better on a hemorrhoid than it will any other vein issue?
Well, because there are other things going on there with respect to hemorrhoids. Hemorrhoids are very affected adversely by the type of stool you have, and that's why keeping eating plenty of fiber and that sort of thing is beneficial. But can they be treated in a similar fashion as for what we do for varicose veins? Yes, they can.
Interesting. Yeah.
You can excise, you can do surgical excision of hemorrhoids, but I think for the most part,
that would have to be pretty radical cases.
Most people can. If you treat them symptomatically and manage your diet, etc., then most of the time you can, allow the hemorrhoids to recede, and most people aren't going to need surgery. But it is an option, absolutely.
Interesting.
So, with respect to some of the more long-standing, venous insufficiency complications, that we've talked about before, the higher class levels of venous disease like skin changes, rash, discoloration, inflammation, ulcer formation, all of those things. Usually, pregnancy and venous insufficiency related to pregnancy doesn't get to that point, just because of the fact that, it takes a certain amount of time, a certain, length of time for the venous insufficiency to get to the point where we're seeing those higher class patients, and one pregnancy in and of itself is not going to do that.
Yeah, I was going to say, gang, if you've been, listening to the program in the past, you know that one of the conditions, or one of the problems, if you will, about venous disease is very, very slow, and the damage accumulates over a long period of time. And you might think, well, pregnancy is a long time. Pregnancy is only a blink.
Yeah.
When it comes time to look at the long-term effects of venous disease based on decades, not 9 months.
Right, right. Yeah. Now, I have seen women who have had multiple pregnancies.
Yeah, I bet.
And after the third or fourth, and each time they have kind of a progression of their venous disease, sometimes those ladies can start to show skin changes in the lower part of their leg. But I think that's probably more a reflection of the fact that their venous insufficiency probably started back during their first pregnancy, and they didn't really choose to treat it until their third or fourth, and that process has gone on long enough. And then also the other thing is, again, weight gain. An adverse amount of weight gain during pregnancy is never a good thing, and that also really impacts, vein function, and the likelihood that vein function is going to continue after the pregnancy.
I have a question, and I when I first read through the materials the other day, I was thinking to myself, I got this question, and it may be really an easy answer, but I've noticed a compilation of a lot of things, and that is that some women, younger women, are career-oriented for a while. They don't start their families until a little bit later. And this is quite common now because of not just education, but extended education, where you want to get a master's, and then you want to get in and do your 3 or 4 years in the field.
Sure.
Then you want to get your $100,000 a year job, and then you want to have a baby. So we have a lot of women that are having babies into their 40s and sometimes beyond. I'm wondering if that complicates venous issues, because this is, as the veins start to deteriorate with age, maybe a late pregnancy may be a little pretty dangerous.
Yeah. Well, just in general, the high-risk pregnancies, they talk about 35 years old.
Yeah, being sort of the
now
cap. Yeah.
As being the limit over which you become high risk. But, does your body tolerate going through something like that when you're 40 compared to when you're, mid-20s? No. I mean, you don't tolerate it anywhere as near as well as you do when you're younger. And also, there are changes, just looking at the integrity of skin and other tissues. I mean, there's a molecule that we talk about all the time called collagen, and collagen is so important to, the structure of most tissues within our body, and collagen starts to become depleted after the age of 30. And so are those women over the age of 30 going to, from a physical standpoint, tolerate it as well as when you're younger? No, you're absolutely not going to. Now, I will say that, physical activity and staying in good physical conditioning, and also limiting weight gain, those are so important to, getting through a pregnancy the best that you can. And I experienced that just recently. My daughter had a child here about 6 weeks ago, so brand new baby, but she's always been very, very active, and she's into CrossFit, and she's into being concerned about what she consumes and all that sort of stuff.
I seem to see a lot in her generation, a lot more inquisitiveness as to diet and exercise.
Oh,
what
definitely.
can and what can I do?
Yeah. I mean, it's all about eating organically and natural and all that sort of stuff. Things that I never even gave a thought to when I was younger. But I will tell you, she went through the pregnancy, delivery, and the postpartum time period like a champ. I mean, she just got through very easily, and that's I'm convinced due to the fact that she just she maintained good, healthy activities, remained in good shape, ate well, et cetera, et cetera. So you can't say too much about all of that.
Yeah, and gang, let me tell you something. And that's a good example. I mean, obviously Dad's a doctor, so I mean, he has something to play in that. But I think that where maybe it's less of a risk is a little bit older, because I think these gals that you're talking about, maybe like your daughter, are in pretty good shape. I mean, they might be, as a matter of fact, instead of in their 20s, in their late 30s, they might be in better shape than they were in their 20s.
Very possibly.
Yeah. I mean, unless they were competing athletically. I'm just talking about people that stay with a hobby and keep going on it, or become a hiker or a runner or something. They've got to be building a pretty good foundation for whatever they're doing.
I think that definitely plays a role. Sure, yeah. And and again, comparing this generation to prior ones, I think, I think that's an important point too. Luckily, the younger generation these days, they're much more concerned about healthy living and exercise and diet, etc. So those are all good things. But after I gave this topic some thought, I came up with a group of frequently asked questions that so many that we hear from so many women that either are thinking about getting pregnant, patients of ours, they're thinking about getting pregnant again, or they're in the midst of a pregnancy, or they're immediately after their pregnancy. There's a lot of questions that group of people have. So, the first question is, does everyone develop vein problems when they are pregnant? And luckily, the answer is no, because pregnancy, although it's very conducive to setting up an atmosphere where chronic venous insufficiency may develop and progress. Luckily, there are other things too, like I mentioned before. In a woman who doesn't have the genetics, if she doesn't have the genetic predisposition to develop vein disease, she may be fine. If she controls her weight and exercises, etc., she may be fine. So, luckily, no, not everybody does.
Okay, here's something interesting. If you've been a fan of the show and heard this before, I've often asked the doc, okay, just give me the pills. I want to go down and get the pills so I don't have any more vein problems. And then we said, okay, what about, give me the diet, because I want to eat the right stuff so I don't have any vein problems. Turns out that there's not a whole bunch going on, depending on what stage of venous insufficiency you have. There's not much going on that's going to be affected by pills, because there just aren't good pills available.
Right.
Maybe someday.
Right.
And the same thing is about the three main food groups are not burgers, fries, and soda pop. I know it has to have something to do with it, but you said that these things don't seem to have major impact on either the way the disease progresses or if you get it or not. In other words, it's great to be in shape, it's great to not be too heavy, and it's great to eat right, but it's not as though those were, indicated treatments for vein disease. Yeah.
Well, I think the point there is that there aren't a lot of things that we can do to alter the course of venous insufficiency if you have it or if you're somebody who's going to get it. And a lot of that has to do with the fact that, again, in so many people, it's a predetermined genetic, part of their makeup that it's likely that they're going to develop venous insufficiency. And so at that point, is exercise going to alter that? No. If you have varicose veins, can you run more and try to make it go away? No. So and you alluded to before, is there a medication that I can take now that is going to take my varicose veins away? No. So unfortunately, we're just left with treating it when it's indicated, and doing things that are going to, I think, limit the progression. And one of those things is compression, garments.
Yeah, you know what? I was just
another.
coming in with that. We talked earlier. I mentioned a little bit earlier, gang, that compression leggings, socks, which really are they're actually medical garments now. They're not. It's not just for cosmetics or for looking. It's actually for your health. But I'm thinking that not only that, but women, they seem to know a lot more about elevation than us men do, especially during times of pregnancy. So if you can figure out a way to dedicate so much time to either compression leg wear or, elevation, even if you're not pregnant, you're better off.
Yeah. Yeah. Those are the two main things that we do when we treat people conservatively: compression and elevation.
I hear so many times pregnant women who say, "I got to go home. I got to put my legs up."
Yeah, right. Perfect example right there of of some state of venous insufficiency. So
but the good news is that there are ways that you can be made more comfortable, and maybe you can talk about them a little bit. Obviously, you don't want to eat food that gives you indigestion or heartburn if you're pregnant, because heaven knows you're dealing with enough already. Mm-hmm. But what you can and can't do with regards to elevation or getting off your feet, if you know why you're doing it, that's probably helpful.
Yeah,
plan it.
Well, right. Kind of schedule it. Put it into your schedule if you can. Some periods of time during the day where you're going to be able to sit down, get your feet up, and remove that constant, downward tendency of blood to pool into your legs.
Pretty hard if you've got a bunch of other little rugrats around, though, too.
Yeah, sometimes it's hard.
Yeah.
So another question: if you develop varicose veins while pregnant, should they be treated during that pregnancy? Mm-hmm. And the answer to that is no. We don't. During the pregnancy, we really don't do much of anything because you don't want to do anything that's going to, in any way, shape, or form, possibly threaten the pregnancy. And who knows what that might be. But the same way with medication and surgery of other sorts, etc. We just we don't fool around with that kind of thing. Well,
you often talk to your mature adult patients like me about travel. There are times to do travel and times not. Times to be prepared. Well, we already know that in the third trimester of pregnancy, travel is not indicated. So, I think that some of these gals, those of you that are out there, these things. Mm-hmm. You plan yourselves around them. That's why, once again, hail to the ladies that's going to do it more than once. It sounds very traumatic to me.
Like they say, there must be a forgetting kind of gene in there, the women have, so that they will have more children. But so if I already have varicose veins, are they going to get worse during pregnancy? And the answer to that, unfortunately, is yes. Yeah. They probably are. Mm. So, and again, unfortunately, after a lady gets pregnant, is that the time to start thinking about treating? Well, that's the time to start planning for eventual treatment, probably. But no, typically, the veins are going to get worse, and there's a limited amount of things that we can do, except those things that we just mentioned, the conservative kind of therapy, and we encourage compression, elevation, and all those things.
Because the fact that motherhood is significantly beautiful and a wonderful thing to be around. A lot of men, I think, out there, and maybe you can learn something, guys. I'm going to learn something. Is that the woman's body just doesn't return to whatever normal was in 2 days after the baby, particularly if there's going to be breastfeeding and all of this kind of stuff for any long period of time. Doesn't that body really stay different for probably another several months after they give birth?
Oh, yeah. Definitely.
Or longer, I would guess.
Yeah. Well, I think it probably is a little different with everybody, but it's at least several months, sure. So, okay, next question. If I develop varicose veins during pregnancy, are they going to go away after delivery? And the answer to that is maybe.
Yeah. I wonder if because of it can't have been terribly severe in that short period of time.
Yeah.
But so when you say when you say, are they going to go away or are they just going to stop where they are? Have they ever gone away?
Oh, yeah.
Amazing.
Yeah, and we hear that that's a pretty common scenario. Where a woman will have to suffer through pregnancy with some, prominent varicose veins that are symptomatic, but she gives birth and they go away. So, but often what happens then eventually is that then she'll go through the next pregnancy and they'll probably get a little worse. They may not go away then at that point, or they may even go away after a second. Usually it's the second or third, that we hear when women come in with varicose veins. They always say, well, they know which baby it was.
Oh, yeah.
It was my third child, and after that
that's number 3 right there.
Yeah.
But what I think is also interesting is not just that, but it's that, when we look at the huge quantity of different creams and things there are to help with things like stretch marks and all of these other things, women really go through some pretty dramatic changes with this whole thing about having babies.
Yeah, definitely. Sure. So,
okay, back to the FAQs.
Yeah. Should I wear support stockings during pregnancy, and will they help? Well, we've already answered that.
Big fat yes.
Yeah. I think that most women are going to benefit from compression stockings, even if they don't have varicose veins, even if they're not worried about varicose veins.
That's what I'm going to agree with.
Even if they don't have a family history, I would recommend that, most women are going to benefit from, some sort of compression on their legs when they're pregnant.
Interestingly enough, I saw something the other day, and I wonder if these qualify or if you think they're good. This guy had on some things that looked to me like leggings. So I walked up to him. I'm going to ask him, what are those things? And they were compression rings, but they had no feet. And they went from mid ankle to the knee.
Right.
And apparently they're easy to get on and easy to keep straight. And they do, so you can still wear shoes and socks and all that stuff if you want to. And that must be another sign of development happening in that field to make it more convenient. Certainly easy. It looked a lot easier to put on and take off.
Yeah. Yeah, those are something that we call sleeves. And typically they go from about the level of the ankle to at the knee. Is that what you saw?
Yeah, I think so.
Those are not good for people who are concerned about, venous function, varicose veins, etc. So would I recommend a woman to wear just those during their pregnancy? No. I really feel like they need to have the foot part of that too.
Oh, okay. Yeah.
Those sleeves are primarily are primarily used for athletic activities. And apparently there has been some, scientific studies done with sleeves that show that they will benefit muscle recovery. So I think that's the big selling point.
In other words, get you back into the game quicker or keep you in the game longer.
Well, keep the muscle. The muscle recovers from activity quicker with that compression as opposed to without. So, however, if you're wearing them for venous reasons and you have a tendency to swell or whatever, often the lower margin of that sleeve will act as a little bit of a tourniquet, and your foot will blow up.
Oh boy. Yeah.
So, and if you're just sitting around the house, or if you're wearing them again for swelling and venous problems, it's better to have the foot, or at least the foot where the toe is open. That type of style of compression stocking would be the best.
Okay, so there's the answer to that. It looks good, but maybe not yet. And I kind of agree. I was going to try them. I was going to get some and ask you what you think, but then I thought, I'm not going to do this because I already know what he's going to say. You need to have that pressure on your foot, only because it seems so natural. If you don't, it's going to end up being a pot down there.
Yeah, right, exactly. We see that all the time. Yeah. So, okay, next question. If I wear support stockings during pregnancy, will that avoid me getting varicose veins? And the answer to that is maybe. Well, actually, maybe with leaning more toward no, but because again, there are these other issues that are going to ultimately determine whether you get vein problems, venous insufficiency, and varicose veins. But again, will it probably limit it? Yes. Will it, kind of diminish the progression? Will it postpone? All these things. The answer is yes. And more importantly, or as important, wearing compression during pregnancy, if you have, any amount of venous insufficiency, it's going to decrease the potential complications, those things like SVT, DVT, all that stuff.
Just out of curiosity, we often talk about the intercommunication between all you specialists. All you, vascular surgeons say OBGYN. Is that something now that OBGYNs are likely to recommend to their patients?
Yeah, we hear that.
Yeah, which is good, right?
Oh, yeah, absolutely.
The more people you have scolding you, the more likely you are to react positively to it.
Yeah, the more suggestions you get. So, okay, next question. I developed varicose veins during my first pregnancy, and they went away. Can I expect the same for future pregnancies?
Signed, hopeful.
Yeah. And I guess we touched on this a little bit before. But unfortunately, no, that's not a guarantee. As a matter of fact, if you had varicose veins during your first pregnancy, then that's an indication that there's some amount of abnormal vein function, and very likely you do have a genetic predisposition. And so it's pretty likely that you'll get them again. Now, but again, like I mentioned before, could you have a second pregnancy, develop varicose veins, and might those go away? Yeah. But at least in my experience, it's kind of been ultimately it catches up with you.
Mm-hmm. Yeah. I mean, I know there's a free lunch somewhere, but not today. Actually, isn't it better to hear the truth? That one of the things we'd like you to do is visit the website. There's a lot of things going on. Vein Clinics of Hawaii on all 4 islands. Go to veinclinicsofhawaii.com and learn a lot more about this. And I was interested particularly because as we go through some of these questions, I know that some of them are based on the fact that you do have patients that do intend to get pregnant again, and this would mean that these are women basically in that different group of say 25 to 40, rather than grandma needing venous work.
Mm-hmm. Yeah. Right. Yeah. So okay, if I had a blood clot with my first pregnancy, am I at risk for developing one during future pregnancies? And unfortunately, the answer there is yes. Like we talked about before, just by virtue of the fact that the pregnancy is going on, you have some amount of intrinsic hypercoagulability. Your blood is going to clot a little easier than it should. But as the patient that's not pregnant, anybody who develops a DVT, their risk of future DVT goes up.
Would it be dramatically?
And substantially, yeah. And so the same can be said for pregnancy.
Okay.
So if you had a DVT during your first one, I think that you have to be, extra especially careful or concerned about developing one during a second pregnancy. And in some cases, depending on, what your, personal physician may think about the topic, in some situations, some amount of anticoagulation may be indicated or beneficial.
Wow.
So.
Yeah, and we touched upon that a little bit earlier, and I think one of the things that I think that people need to know about, and I think it's mainly because so much of this seems to be getting exposed to us now. I mean, we hear them on our radio stations, certainly over the TV all night. We're supposed to all of a sudden embrace all these funny names of medicines that we never knew about.
Yeah.
And a lot of them seem to have to do about blood.
Yeah.
And a lot of them are blood thinners.
Right.
Some of them are actually pretty scary. I mean, there was one that shows this guy that's, I guess, sitting down to have dinner with his family, and they roll up a gurney behind him. They're going to take him away from the table unless he does this, unless he does that.
Yeah.
But I think that certainly women, if anything, should be encouraged to go ahead and do what they want with regards to having babies, because there's a lot of people that are standing by to literally help give them help at every corner.
Mm-hmm. Yeah, sure, right. So okay, now this is a question that we hear a lot, and so there's women unfortunately get kind of variable answers depending on who they're asking. But this question is: I have bad varicose veins right now, but I want to have other children in the future. Should I wait until after my final pregnancy to be treated for my varicose veins? Yeah. We hear that question a lot. And what I tell people is that no, if women are having substantial symptoms from significant venous insufficiency, I encourage them to typically get it treated.
Yeah, that's good.
Because I
don't want to scare people from saying, "Oh boy, now I can't get pregnant because I don't want to get I can't get treated."
Yeah. So and why would you want to do that? Well, you want to do that because you want to avoid the symptoms, the additional symptoms that you're going to have during a subsequent pregnancy because of your ongoing venous insufficiency and varicose veins. Number one. Number two, you want to avoid the potential complications that you might have because of venous insufficiency and varicose veins that you will be, having during a subsequent pregnancy. So, it's in my mind, again, it's more than worthwhile to have it treated. And the other, kind of along those lines, is, if I get my veins fixed and then I have another pregnancy, am I going to have more problems after that? And the answer to that is, well, you may or may not. But typically the things that we fix, before the pregnancy, they stay fixed. It's not like, the veins that we address before or after a pregnancy and before the next. It's not like those veins are going to be a problem again. We've taken care of those. That's pretty permanent. Might you have more problems, but usually it's sort of minimal, and we can take care of them easily.
Yeah, and gang, this hopefully will come as a big relief. Hopefully, some of you guys have stuck around, not just to appreciate what your ladies are going through, but also how many medical professionals. It all turns, whether it's OBGYN. And one thing you said, I think, in previous programs, guys. If this is your one takeaway, that's good, especially for your own self. That those veins that you have treated aren't coming back because they've been replaced by something else. And if you are a venous disease sufferer, in all likelihood, those are going to become problems. And at what point in time did they completely go away? Probably the answer is never. But certainly the symptoms that you go through, they can be addressed, right? And in many cases, the appearance can be addressed.
Sure. Yeah.
So this is all good.
Yeah. So, and then the final question I have here: if I develop varicose veins during pregnancy, should I come into the office to be evaluated? And usually we answer that with a yes. Yeah. Even though we're not going to do anything interventionally during that pregnancy, we can always kind of get an idea about where they are. In the process of their venous disease, number one. Number two, we can make sure that they're doing all of those things that they should to, limit complications and, symptoms, and give them our thoughts on, kind of how to best get through that pregnancy.
Yeah, I was going to ask you that, and one question to that visit where I would imagine, if possible, you want to do an ultrasound because you want to have that record. So that as we can go by another year, that, when you were here during your pregnancy, this is what it looked like, and here's where it was, and here's where it is now, so we need to do some more treatment here pretty soon. Yeah.
Well, typically we would. We would do an ultrasound during their pregnancy, but also when they come back after their pregnancy, we would probably repeat it just to kind of define what part of their venous disease has receded because of the termination of the pregnancy.
Well, I hope that some of you guys have stuck around. If not, Mama, you better tell them that maybe someday we'll figure out how to listen to this program. One of the things that we want you to do is you'll see, as you can see by what we've talked about here on this and other programs, this is a huge category, and it affects lots and lots of people. And so that's why we want you to go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com. And take a look at, it's not, certainly not doom and gloom. There's so many things that can be done to help you live a better life and have a better quality of life as a result of getting diagnosed and treated. And even those of you that want to become mommies again, or for the first time, go for it. Because one of the things that's going to happen for sure, after you're done with that, you get back to the, I'm going to the beach thing again. And maybe that'll make things a little bit more tolerable. And guys, I hope that you've learned something today, because it's pretty important what these ladies go through. I know for Doc and me, you got our attention and our deep gratitude. Thanks for listening. We'll see you next time. VeinClinicsOfHawaii.com. Remember that, VeinClinicsOfHawaii.com.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com.